Well, welcome back to your happy hour here at 9:30. It is Wellness Wednesday, and we are talking about mental health problems in children and teens.
And joining us today is Dr. Lindsay Cirencioni, a pediatric psychologist and owner of Align Behavioral Health, to share some of the warning signs and tips on what to do if your child is suffering with mental health. Good morning. Thank you so much for joining us this morning on this topic.
This is a topic that you can't talk about enough. You know, the kids and teens, we were just talking about how tough it is to grow up as a young one these days. They face so many things.
Yeah, and it's a different world. Yeah.
And tell us what the statistics that you're seeing, or maybe what you're noticing at your own practice about what's happening in this industry.
Yeah, so the CDC's latest research is telling us that when we think about elementary age kids, we're actually seeing up to 10% of kids in elementary school with depression and anxiety. And then when we move into the teenage years, that increases exponentially. So what we know is that up to half of teenagers and adolescents are facing mental health diagnoses such as anxiety and depression. The tricky piece here is that these are the kids who are diagnosed and getting treatment. And we know that there are far more kids out there who may be suffering who just don't know that this is something that can be helped or treated. So we anticipate that those numbers are actually a lot higher than what the data is telling us.
As if middle school, high school wasn't difficult enough. Now you add social media to it.
Yeah.
It's something, it's never ending. How has that been identified as impacting their mental health?
Yeah, so social media really is a two-sided coin, right? It really connects kids in ways that they may not otherwise have access to people who are like them or think like them or interested in the same things that they're interested in, but it also can really significantly contribute to mental health problems. So kids who are spending more than 4 hours a day on social media, which to us sounds like an astronomical amount, but it's actually pretty common, those kids are far more likely to have depression or anxiety. And then just like we see in sort of in-person real-world scenarios, the cyberbullying that happens on social media can really increase rates of anxiety, depression, and even suicidal ideation in teens.
Wow. And so for parents and guardians, when they're watching their kids grow up, what are some of those symptoms and signs they should really be looking out for? I'm sure it varies among each kid.
Yeah, it varies based on each kid, but it also, when we think of symptoms of anxiety and depression or other mental health concerns in adults, we kind of have this idea of what it looks like. And kids can certainly have those same symptoms, right? Withdrawal, sadness, worry, fear, but there are also other signs in kids that may be different than what we see in adults. So kids can tend to be irritable or frustrated more often. We can see a lot of somatic complaints in kids, so things like headaches and stomach aches that don't necessarily have an identified medical cause. We can see school avoidance. We can see a drop or a decline in academic performance, and we can also see more difficulty separating from families in kids and teens.
We have a website on the screen. Is that where you suggest that folks reach out for resources?
Yeah, absolutely. I'm usually putting out a lot of good resources on mental health on my website, and folks can also contact me if they have any specific questions about how their kids and teens are doing.
Align-health.com.
Yep.
Thank you, doctor.
Thank you very much.
Very timely.
Appreciate
Thank you
it
so much.